Medical sciences has witnessed paradigm development in the last few years, and we are presenting one such development in the field of gastrointestinal endoscopy. This is known as POEM, or per-oral endoscopic myotomy. You must have seen a painter painting his or her creation. Likewise, POEM is also an artwork where a specialized endoscope is used to do artwork in the layers of the food pipe. This has revolutionized the treatment of despondent patients with dysphagia, or difficulty in swallowing, which can be because of diseases like achalasia cardia or other food pipe motility disorders. When I first booked my first case, my anesthesia colleague said poem means some rhyme, or this is a medical procedure. Ever since, we have done a good number of cases, a few quite difficult ones. One I remember was a recurrence after Heller's myotomy.
This gentleman lives in Kazakhstan, got Heller's myotomy. It was the only treatment available at that time. This was Heller's is a surgery done from the chest wall. And in mid-2012, started developing symptoms again. He lost a lot of weight. He was particularly scared because this was a recurrence. Somehow he's referred to us. We explained the procedure of POEM. His esophagus was like this S shape, and technically we call it a sigmoid esophagus. One of the difficult cases. Did POEM successfully.
My name is Parviz Molojonov. I am from Tajikistan. Achalasia, which is very hard disease for many years, especially for the last year. And it actually was a very complicated case. So I'm very grateful, very happy that I managed to do this surgery here. So I did not know that there is a new methodology, POEM, which is much more better.
Yes.
Yeah, and then I'm very happy that actually I managed to come to this hospital and to find such a good specialist.
Mr. Aditya is suffering for 5 years. Difficulty in swallowing. He's working in a corporate house as senior executive. Lost around maybe 25 kg. Quite puzzled. Did a lot of research on his own. What may be the best possible treatment. And somehow came to us. We diagnosed on the basis of manometry as achalasia cardia.
In 2017, I had a swallowing disorder, which means that I had difficulty swallowing food. I was not even able to, kind of swallow tea and even water. And that is the time when I was referred by our family doctor to Max Hospital to Dr. Naresh Agarwal.
And we advised him the latest treatment, which is called POEM.
Dr. Naresh Agarwal advised the POEM procedure to solve this problem. And once this surgery was performed, my entire life changed. I had lost weight almost, I had lost about 17 kgs in the last 5 years owing to my swallowing disorder. And now, I have gained back those 17 kgs in a matter of 8 to 9 months after the surgery.
4 months down the line, to tell him, don't get obese.
Proudly, the concept of third space endoscopy was first given by an Indian gastroenterologist in the USA, Dr. Pasricha, and then the first human series was published by Dr. Inoue from Japan.
मैं खाना खाता था तो मेरा खाना पलट जाता था, मतलब करीब 20-25 साल हो गए। फिर इसके बाद मुझको पता चला तो फिर यहाँ मैं दिल्ली आया, डॉक्टर नरेश अग्रवाल जी से मिला, तब मेरा ये इलाज हुआ। अब मुझको कोई तकलीफ नहीं है, मतलब 7 तारीख का मेरा ऑपरेशन हुआ। 7 तारीख से बाद इतने दिन, मतलब करीब 15-20-25 दिन हो रहे हैं। तो अब मुझको कोई तकलीफ नहीं, मैं खाना भी आराम से खा लेता हूँ, पानी भी पी लेता हूँ, मुझको कोई दिक्कत नहीं है।
15 лет назад, наверное, 15 или 20 лет назад был такие проблема у меня, а сейчас я операцию сделал за 6-7 дней назад операцию сделал, они хорошие сделали, ничего нету у меня, боль, больше ничего нету. Хороший кушаю, хороший, ничего нету, жажды больше нету. У меня жажда был там. Чуть-чуть узкий стал там. Они все убирали, хороший стал я.
Okay.
Да, хороший кушаю, 100% хороший кушаю. Ничего нету, боль, моль у меня, желудок больше, ничего нету. Ладно, хорошо.
One more was a child of 6 years who was very fond of pizzas but was not able to ingest because of achalasia. But after POEM, she is back to pizza corners.
This little child He's around maybe 6 years in age. He's fond of Italian breads. And for last 1 year, she became like a child of 3 years because of weight loss. Diagnosed as eclasia cardia. She's back to pizza corners.
3 साल से खाना अंदर नहीं जाता था, पानी भी अच्छे से नहीं लगता।
ठीक हो गई है, अब काफी कुछ खा रही है, जो खा रहा है वो पच रहा है इसको।
I feel so thrilled every time I do Poem because the relief is almost instant. Hospital stay is quite limited to 1 to 2 days, no external wounds. We hope more and more development in this field will happen, and maybe we will see a day filled with robotic Poem.